Parasitic infections. We're looking at some of the common parasitic infections, which include the ailments like Shistosomiasis, Hookworm disease, African Trypanosmiasis or sleeping sickness, Cryptosporidiasi. Shistosomiasis or bilharzia is a snail-transmitted waterborne parasitic ailment. Hookworm or soil-transmitted infection is caused by the nematode parasites. Okay, so this is how Shistosomiasis develops. So acute Shistosomiasis or catayambus fever may occur weeks after the initial infection. Okay, so step 1 is the larvae are in feces and in urine, and the eggs hatch and release microcidia. And these microcidia penetrate the snail tissues. Then in the snail you have sporocysts. In the sporocysts you have cercariae released by snail into the water, which are free swimming, which are taken by the humans and they penetrate the skin. Cercariae lose their tails during penetration and become schistosomial, and then they go into circulation, and then they migrate to portal blood in liver and mature into adults. Then paired adult worms migrate again and to the mesenteric venules, the bowels and the rectum, where they lay eggs and circulate to the liver and shed in the stools. Symptoms: fever, cough, abdominal pain, diarrhea, hepatosplenomegaly. Eosinophilia, portal hypertension with hematemesis and splenomegaly. Cystitis and urethritis with hematuria. Pulmonary hypertension. These are the main symptoms of Shistosomiasis: fever, cough, tummy pain, diarrhea, hepatosplenomegaly, eosinophilia, portal hypertension, cystitis, pulmonary hypertension. Clinical presentation is also known as swimmer's itch. Most often occurs 2 to 3 days after invasion as an itchy maculopapular rash on the affected area of the skin. Diagnosis is based on the following: clinical signs and symptoms, history of living in an endemic area, serological tests for antibodies and parasite antigens, finding the characteristic eggs. Microscopic identification of eggs in stool or urine is the most practical method for diagnosis. Stool examination should be performed when infection with Shistosomiasis mansoni or Shistosomiasis japonicum is suspected. Urine examination should be performed if Shistosomiasis hematubium is suspected. Eggs can be present in the stool in infections with all Schistosoma species. Treatment is topical or systemic steroids, can be for cercarial dermatitis and severe acute Shistosomiasis. Drug of choice is praziquantel for infections caused by all Schistosoma species. Single oral dose of 40 mg per kg is generally sufficient to give cure rates between 60 to 90% and reduction of 90 to 95% in the average number of eggs excreted. Oxaminoquine has been effective in treating infections caused by Shistosomiasis mansoni in some areas in which praziquantel is less effective. Patient education is always very, very important. Avoid contact with water known to contain cercaria. Provide safe water supply to the community. Construct footbridges across infested rivers and streams. Provide safe recreational bathing sites. Prevent water becoming contaminated with the eggs by health information on excreta disposal, treating infected persons, providing sanitary facilities, taking environmental measures to prevent seasonal flooding, which results in an increase in snail numbers in transmission, treating water supplies by using a chlorine disinfectant wherever possible, storing the water for 48 hours to allow time for any cercaria to die, using filter systems at water inputs to prevent cercaria. Let's have a look at hookworm. What is hookworm? Hookworms live in the small intestine. Eggs are passed in the feces of an infected person. If the infected person defecates outside near bushes in a garden or a field, or if the feces of an infected person are used as a fertilizer, eggs are deposited in the soil. They can then mature and hatch, release larvae. Larvae mature and penetrate the skin of humans. So this is how the hookworm cycle looks like. You can see that the eggs are laid in the feces. Now these eggs hatch into rhabditiform larvae, which convert into filariform larvae in stage 3. The filariform larvae penetrate the skin of humans in stage 4. So what are the symptoms of hookworm? Abdominal discomfort, blood in the stools, bloody sputum, cough, diarrhea, fever, and itchy rash. Okay, so there are symptoms of hookworm. Some may have nausea and vomiting as well. Diagnosis of hookworms. Complete blood count, stool, and parasitic exam is the main diagnostic modality. So this is how you see hookworm in the stools. Treatment: cure the infection, treat complications of anemia, improve the nutrition. Parasite-killing medications such as albendazole, mebendazole, or parenteral are usually prescribed. Increase the protein in diet to reduce complications of anemia. Prevention is by efforts to control hookworm infection, including the sanitary disposal of feces and educational campaigns about the proper use of latrines. Wearing shoes can help to prevent the hookworm larvae from penetrating the feet. Proper disposal of feces in areas away from habitations can prevent the occurrence of infected larvae in the environment. Complications include iron deficiency anemia caused by blood loss, nutritional deficiencies, protein loss with fluid buildup in the abdomen, high chance of reinfection. Trypanosmiasis or sleeping sickness, caused by microscopic parasites of the species Trypanosoma brucei, transmitted by tsetse fly Glossina species, which is found only in rural Africa. Tsetse flies bite during the daylight hours, so that's very important. Both male and female flies can transmit the infection. Now, this is a geographical distribution of African Trypanosmiasis. So it lives in the most savanna and woodland regions with more than 500 millimeters of rain a year. Now in the first stage, the parasite is found in the peripheral circulation, but it has not yet invaded the central nervous system. The second stage occurs once a parasite crosses the blood-brain barrier and infects the central nervous system. Clinical presentation: most patients develop fever, headache, muscle and joint aches, drowsiness, sweating, mental status changes, enlarged lymph nodes within 1 to 2 weeks of infective bite. After a few weeks of infection, the parasites invade the central nervous system. Diagnosis: classic method for diagnosing African Trypanosmiasis infection is a microscopic examination of the lymph node aspirate, and usually from a posterior cervical node. All patients diagnosed with African Trypanosmiasis must have their CSF examined to determine whether there is involvement of the central nervous system. A physical examination may show signs of inflammation in the brain and its covering. Tests include blood smear, CSF test, CBC, lymph node aspiration. Treatment includes pentamidine and suramin as first stage. Educate your patients. Pentamidine may affect blood sugar, headache, chills, pale skin, shakes, anxiety, and cold sweats. Okay, so patients taking suramin may experience cloudy urine, crawling or tingling of the skin, diarrhea, faintness, increased skin color, itching, joint pain, nausea, skin rash. Without treatment, death may occur within 6 months. Complications include injury related to falling asleep while driving or performing other activities, progressive damage to the nervous system. Sleep becomes uncontrollable as the disease gets worse and eventually leads to coma. Inflammation of the heart can happen. Prevention and control: there is no vaccine or drug for prophylaxis against African Trypanosmiasis. Preventive measures are aimed at minimizing contact with CC flies. Wear long-sleeved shirts and pants of medium-weight material in the neutral colors that blend with the background environment. CC flies are attracted to bright or dark colors and they can bite through lightweight clothing. Inspect the vehicles before entering. So this is a CC fly. The fly is attracted to the motion and dust from moving vehicles. CC fly is less active in other parts of the day but will bite if disturbed. Cryptosporidium. Cryptosporidium is a microscopic parasite that causes the diarrheal disease. It passed in the stool of an infected person or animal, commonly known as crypto. The parasite is protected by an outer shell that allows it to survive outside the body for long periods of time. How Cryptosporidium spreads? Accidentally ingesting something that has come into contact with the stool of a person or animal infected with crypto. Swallowing recreational water contaminated with crypto or water that can be contaminated with sewage or feces from humans or animals. Eating uncooked food contaminated with crypto. Touching your mouth with contaminated hands. Hands can become contaminated through a variety of activities such as touching surfaces. Exposure to human feces through sexual contact. Clinical presentation. The most common symptoms are watery diarrhea, stomach cramps or pain, dehydration, nausea, vomiting, fever, weight loss. Symptoms begin 2 to 10 days, average 7 days after becoming infected with the parasite. Young children, pregnant women, and those with weakened immune system may be more susceptible to the dehydration resulting from diarrhea and should drink plenty of fluids while ill. Submit the stool sample to see if you're infected. Testing for crypto can be difficult. Several stool specimens over several days may be necessary. Treatment is nitazoxanide, which has been approved for the treatment of diarrhea. Most people recover who have good immune systems. Plenty of fluids are needed for diarrhea management. Young children and pregnant women are more susceptible to dehydration. HIV positive individuals who suspect they have crypto should contact their healthcare provider. Cryptosporidium can be very contagious. Wash your hands frequently with soap and water, especially after using the toilet, after changing diapers, and before eating or preparing food. Do not swim in recreational waters. You can pass crypto in your stool and contaminated water for several weeks after your symptoms have ended. Immersion in the water is enough for contamination to occur. Avoid close contact with anyone who has a weakened immune system. Children with diarrhea should be excluded from childcare settings until the diarrhea has